I had a patient come in this morning. She's doing chemotherapy right now for leukemia. She came in today and she was getting whooshing into her brain every single time she bent forward. She had these suboccipital headaches. When it squeezes the back of the head like that and is extremely reactive to bending forward, it usually comes from the sacral area or fifth lumbar. So this is a perfect example of when you can have a chemical irritation. So she had a lumbar puncture where they're administering chemotherapeutic drugs and it caused a subluxation at that level, where that fifth lumbar got a ton of swelling, that disc started failing, and then that vertebrae slides off that disc and starts causing nerve pressure. And along with that nerve pressure, it started changing the way the cerebral spinal fluid was able to pump up into the skull and come back down. And after doing the full exam, scope, palpate, referencing her x-ray, I put her on the pelvic bench and got on L5. It was a PRS listing, so I got my left hand on it and I set this thing up and it moved just the tiniest amount. And before she even sat up, she said all her head pressure was gone. And I'm not saying this to say that I'm all that great. I'm teaching this because if we have patients that come in that are complex cases, complex pain, chemistry issues, autoimmune, cancer, failed back surgery, you can still help them with a specific exam or with a specific correction. Do you have a system to actually analyze this and start to correct it? I hope this message helps you expand your care and change the way that you look at patients when they come in your office. Cheers.